Hello again. This is Deborah Bean with the Mount Crescent Ski Patrol with the Rocky Mountain Division of the National Ski Patrol. Again, you can contact me through crescentskipatrol@gmail.com if you have any questions or concerns. We will be discussing gastrointestinal and genitourinary emergencies from Chapter 16. Again, be sure to read that textbook as there are other explanations that might be very beneficial to you. The objectives of this chapter are to list at least 6 possible causes of emergencies involving the GI and genitourinary systems, list the signs and symptoms of emergencies involving the gastrointestinal and genitourinary systems, and compare and contrast visceral pain and parietal pain. Describe and demonstrate how to assess the abdomen, and describe and demonstrate the management of a patient with a severe GI or GU emergency. The topics will be anatomy and physiology as always, the acute abdomen, the common gastrointestinal ailments, assessment and management, and chapter summary. This guy comes to you uncomfortable, holding his abdomen. What do you think? And where are you? Okay. Here's the rest of the story. You're working first aid duty when a 35-year-old man walks in complaining of severe abdominal pain. You assess the patient. Moments later, he vomits. The vomit is clear and does not appear to contain blood. He apologizes and states that he started feeling ill that morning but decided to ski with his family. He denies any past medical history, has not suffered any recent trauma, and is not currently taking any medications. He states he has never experienced anything like this before and describes his abdominal pain as intense. So what should you do? Let's start with the fundamentals. Use standard precautions. He's talking to you, so we know he has a good airway and breathing. We'll emphasize the D as in disability. His color is good at this point, and his skin is warm, so we know he has good circulation, but we will continue to assess him. He's already given you a lot of information about medicine, that he hasn't ever had anything like this before, when it started, but you can continue to ask him some more about allergies, anything else that's involved with the sample. Last oral intake might be beneficial since he is having abdominal pain. Use OPQRST to discuss the pain with him. Does it radiate? What time did it start? How severe is it? How do you rate the pain? Use those to further understand the quality of his pain. Go ahead and call EMS. Going to advanced medical care is important when abdominal pain is intense because it indicates that there's something really wrong. Do a focused exam based on his chief complaint, which means you're going to palpate his abdomen and determine if you can isolate the pain or tenderness. Continue to do baseline vitals, give him oxygen, it might make him feel better, and we're going to reassess him. How often? Because the abdominal pain is intense, we're going to suppose that it's probably a serious condition, so 3 to 5 minutes is appropriate to continue his reassessments. Looking at the anatomy and physiology of the abdominal system, of course, it's very complex. And we'll note the 4 quadrants, and let's review the function of the internal organs. We notice the liver. It makes proteins. It does so many things. It synthesizes blood clotting chemicals or produces bile to aid in digestion of fat, plus so many other functions. The pancreas produces digestive enzymes and hormones to regulate blood sugar. The spleen stores blood cells and helps to make antibodies, and ovaries in women, of course, produce eggs. Posterior to the abdominal cavity are the kidneys that filter and excrete liquid waste. The ureter, of course, passes from the kidneys to allow urine to be excreted. Okay, so let's consider the hollow organs. Remember that they contain fluids that will leak if the structures are ruptured or they're lacerated. This could result in peritonitis or otherwise inflammation of the peritoneum. Remember that the peritoneum is the thin membrane that lines the abdominal cavity. It contains both sensory and visceral nerves. The solid organs are highly vascular, and damage can result in profuse bleeding that can lead to hemorrhagic shock. Take a look at figure 16.3a and b on page 497 and 498 to review the major vessels of the body, especially at the abdominal area. Note how large and how numerous these blood vessels are. Of course, the blood vessels transport blood, nutrients, and waste. The causes of acute abdomen are widespread. For acute abdomen, the sudden, severe, unexplained pain in the abdomen covers so many different maladies, so you probably won't know which one it is. Rapid recognition is paramount because advanced medical care is often urgently needed. Even physicians have trouble diagnosing abdominal maladies, so they must rely on imaging and other testing. An important note, when you are palpating the 4 quadrants of the abdomen, do not start with the area that seems to be most painful. Palpate that one last, so you'll get to the other ones, and they won't put the patient in any more pain. Okay, let's take a moment to discuss visceral versus parietal pain. Parietal pain occurs when there is an irritation of the peritoneal lining. Remember that the peritoneum has a high number of sensitive nerve fibers, so the pain is generally more severe and easier to localize. The patient will typically present in a guarded position with shallow breathing. The parietal nerves are the serous membrane lining the cavities of the abdomen and covering the abdominal organs. Visceral nerves, with visceral nerve irritation, the pain is diffuse and it's difficult to pinpoint as they spread over a wide area. When there is distension or contraction of the peritoneum, various stretch receptors can cause pain at a distant location. This is called referred pain. As illustrated in the photo, the typical sign of referred pain from different organs is typical, and we'll be discussing that. Causes of acute abdomen. Oh, these are such a variety. It could be a bowel obstruction, it could be a perforated bowel, peptic ulcerative disease, esophagitis, and gastrointestinal bleeding, abdominal aortic aneurysm, and if it's a female, it could be OB/GYN related conditions. Common abdominal ailments are gastroenteritis, and that's an inflammation of the lining of the intestines caused by a virus, bacteria, or parasites. Viral gastroenteritis is the second most common illness in the U.S. Symptoms of gastroenteritis include diarrhea, abdominal pain, vomiting, headache, fever, and chills. The patient could be suffering from just indigestion. They could have nausea and vomiting from other sources. Colic is a severe, often fluctuating pain in the abdomen caused by intestinal gas or obstruction in the intestines. We often see this in babies. Diarrhea from a host of reasons. Many who exhibit these conditions should be referred to advanced medical care for more comprehensive examination by a physician. Additional and common ailments are viruses, protozoa, and bacteria like Staphylococci, Salmonella, Giardia lamblia, and Cryptosporidium. E. coli we often hear about in the news when lettuce or some other food is tainted with that bacteria. And constipation is common. Serious gastrointestinal or genitourinary conditions that are serious and can be fatal if the emergency care is not delivered are appendicitis, pancreatitis, hepatitis, which involves the liver, cholecystitis would involve the gallbladder. Pyelonephritis is a sudden and severe kidney infection. Nephrolithiasis, are otherwise known as kidney stones, which can be extremely painful. A bowel obstruction or a perforated bowel. Peptic ulcer disease, GERD, and gastrointestinal bleeding is another serious condition. Abdominal aortic aneurysms, or AAA, is very serious and does not usually have a good outcome. Of course, OB/GYN related conditions like an ectopic pregnancy or other conditions could be very serious. Okay, here you are with your patient. It looks like we might be in kind of a public place. It would probably be better if you could get this patient to someplace more private, since you will be doing an exam, and have more resources, and so you can lay down. Okay, you're going to, upon examination, you notice the patient is pale. He's sweating and he feels warm to the touch. He relates that his pain was originally near his belly button, but has now moved down and to the right. Examination of the abdomen reveals severe tenderness in the lower right quadrant. He tells you that every bump on the way to the ski hill felt like being stabbed in my gut. The patient has a heart rate of 116, blood pressure is 132/88, and his respirations are 20 and shallow. Okay, let's determine what's wrong with this patient. Okay, examination reveals that the pain has changed. So let's do some of the basics here. We've checked the ABCDs. How is his breathing? He's giving you a lot of information with the sample. Go into more detail. Check his pain. On the physical exam, be sure to ask for permission to access his abdomen, and then do your abdominal. Okay, let's look at the possible causes of emergencies involving the GI and GU systems that are explained more fully in your text starting on page 500. I would recommend that you take a look at those to remind yourself of the different conditions. And this is the end of part 1.